If you've ever been seriously injured, you know it's not just a physical thing. I mean, sure, your body is broken and needs to heal, but the mental game, that can be a whole other battle. Today, we're going to dive into a practical guide for totally mastering that mental side of recovery. You know that first moment right after an injury happens? Your entire world just shrinks. That's really phase one, the initial shock. It's this wave of panic, the sharp reality of the pain, and then this sudden, incredibly frustrating list of things you suddenly can't do. It is a really tough place to be. So that's the big question, isn't it? When your body is letting you down, and everything you've trained for feels like it's just slipping through your fingers, how in the world do you fix your mindset? How do you build a way of thinking that doesn't just get you through recovery, but actually drives it? Well, that is exactly what we're going to break down. All right, let's get into it. To fix your mindset, you've got to understand it first. The psychological journey of an injury kind of has its own map, you know? And just knowing the terrain is the very first step to getting through it successfully. So on the physical side, rehab usually follows these three phases. First, you're just managing the immediate trauma, the pain, the swelling. Then you start rebuilding and getting that function back. And finally, you're fine-tuning everything to get back to your sport. But here's the thing. At every single one of these stages, your mental game isn't just a nice to have, it's absolutely essential. And what is the single most powerful tool you have for that mental game? It's goal setting. Now, this isn't about just thinking positive thoughts. This is a structured, proven strategy that can literally change how your entire rehabilitation goes. Let's dig into why it's so effective. So, why does this really work? Well, it all comes down to one really important word: adherence. It's just a fancy way of saying sticking with the plan. And let's be real, rehab can be long, it can be boring, it can be painful. Goal setting gives you a concrete reason to show up every single day and do the work, especially on the days you really don't feel like it. And that commitment, that adherence, it creates this incredible ripple effect. When you set and hit these small goals, it fires up your motivation, your effort, your persistence. It builds your confidence. It helps you fight off that feeling of apathy, that why bother feeling that can creep in. You're basically taking back control, and that completely changes how you think and feel about the whole process. Okay, so we know why it works, but how do you actually do it? It's not about just pulling a random target out of thin air. There's a method to the madness, a blueprint that helps organize your entire recovery into a clear, manageable plan. And here it is. This is the blueprint. This is the roadmap for your entire recovery. Now, I know what you're thinking. It looks a little complicated, right? But trust me, once you get it, it's an unbelievably powerful and actually very simple tool. Just think of it like a map. The vertical line, that shows the levels of your goals, from what you're doing today all the way up to your final victory. And the horizontal lines, those are the types of goals you'll set. We're going to break down this whole map, piece by piece. So let's start with that vertical axis, the levels. This is all about time. It's about structuring your recovery so you're stacking small, daily wins on top of each other, all of them building towards that one big final victory. Here's how it works. Your long-term recovery goal, like, say, getting back on the field for the season opener, that's your North Star. To get there, you'll set medium-term stage goals for each phase of rehab, and those are built on a foundation of daily goals. What are you going to get done in this one session today? And we can't forget lifestyle goals, because recovery doesn't end when you leave the gym. Sleep, diet, that stuff is just as critical. Okay, so we've got the when covered. Now let's look at that horizontal axis, the what. This is about the different types of goals you need to set to make sure your recovery is, holistic and complete. For your recovery to be successful, you have to address all three of these areas. Physical goals are the obvious ones, right? Hitting a certain range of motion, lifting a specific amount of weight. But the psychological goals are just as important. Things like rebuilding confidence in your injured knee. And finally, you have performance goals, which are all about getting back your specific skills and conditioning for your sport. You need all three: mind, body, and performance. So we have the blueprint, we know the levels and the types of goals we need to set. So now for the big question: how do we actually put this thing into practice? Let's walk through a super simple 4-phase process for making this whole framework a reality. And here it is, your 4-phase action plan. First, you assess where you're at and identify your needs. Second, you set effective goals based on that assessment. Third, you think about the key factors that'll help you succeed.
And finally, you integrate it all into your program. Let's kick it off with phase 1.
Phase 1 is all about knowing your starting line. I mean, you can't chart a course if you don't know where you are on the map, right? So this starts with something called rehabilitation profiling, which is really just a structured way of getting a really honest, visual look at where you stand right now. And this right here is the key tool for that, the wheel of awareness. It is a brilliantly simple way to rate yourself on things like confidence, anxiety, motivation, you name it. You just shade in where you're at for each area, from the center out. And instantly, you get this honest picture of your strengths and, more importantly, the areas that really need your focus. It turns all those vague feelings into actual data you can work with. So, once you know what you need to work on, phase 2 is about setting the right kind of goals. They have to be specific and measurable, not just get stronger, but I'm going to lift X weight for Y reps. They need to be challenging, yeah, but also realistic. And here's a huge tip. Say them in a positive way. Focus on what you will do, not what you'll avoid. And finally, celebrate the progress along the way. Focus on how far you've come, not just a simple pass-fail.
All right, we have covered a lot. We've talked about the why, the what, and the how. Now for the most important part. Let's bring all these pieces together into one single, actionable program that you can literally start using today. Here it is, your 5-step checklist. It all starts with a conversation. Talk to your physical therapist, your athletic trainer. This is a team effort. Together, you set those clear physical goals. Then you use a tool like that profiling wheel to talk about and set your psychological goals. You agree on the game plan to get there. And this is so critical. You have to remember to check in on these goals, to revise them as you progress. This is how you really take ownership of your comeback. Look, an injury can make you feel like you've lost all control. Like, this is a story that's being written for you. But goal setting lets you grab the pen and start writing the next chapter yourself. It turns recovery from something that just happens to you into a journey that you actively lead. So the only question left is, what's your first goal?